Hi, my name is Kathy. I come from Canada. I came all the way to India to get a mini bypass surgery. I had the surgery done on September 12th, just 9 days ago?
Yeah, 7 days ago.
7 days ago, thank you. And it was the best decision I've made in a long time. I needed to make a change in my life. Was having difficulty walking. I had knee issues. I even had a knee operation. I'm getting arthritis in my knees. I feel tired. I can't go upstairs. I can't play with my children. So I wanted to make a change. And so I came here to get a surgery done. And I heard about Dr. Saggu and I wanted to meet him. And when I did, I was pleasantly surprised at how easy it was to feel secure and confident, how easy he made me feel at ease and made me feel confident about the operation I was going to have. And the operation happened. I feel good. I felt very little pain. I've recuperated very quickly. I'm very astonished at how fast the recuperation process is. So very happy that I had this procedure done. Before I left Canada to come here, I weighed 295 pounds and I am now down almost 20 pounds, less than 10 days. So very happy and looking forward to the rest of my life.
Yeah. And Mrs. Ketty, she came with Mrs. Raymond, her mother, and she was also weighing 118 kgs. And can you please tell me, Mrs. Ketty, what was the problem you and your mother was facing so that you took a decision to go for the mini gastric bypass?
Well, for me, like I said, it was a lot of the arthritis in the knees and the pain. And for my mom, she's on a lot of different kinds of medication for blood sugar, she's also has a breathing apparatus for sleeping. So we're trying to help her be more mobile as well. A lot of difficulty moving around.
Yeah.
So, yeah.
So she was a diabetic and she was on 3 drugs, and she was taking 3 drugs. She was on CPAP because of OSA, that is a sleep apnea, and she was taking inhaler for the asthma, and so many problems she had. So we did surgery on 12th for Katie, and we did surgery on 13th for Raymond. Both of them, they underwent a mini gastric bypass. And after the surgery, what is your experience after the surgery?
Well, I'm surprised. I thought I would be in a lot more pain and be in the hospital for a long time and suffer. And I'm surprised at how fast we recuperate and how easy it was to do the transition from not having the operation and then living with a bypass, so mini bypass.
Yeah. Kadi, many people, they are very scared of the surgery and they think that after the surgery we cannot eat, there is so many things, so many problems are there. So did you have that kind of problem?
I had the worries. Of course I had the worries. I don't feel like I have the problems. I understand the process that takes to get to where I want to be. And I know that right now I'm not eating the solid foods, but I will. And I'm being assured that it won't be a problem. And the people that I know that have gone through the bypass that you have done for them have all pretty much said that they now eat what they want, just in a smaller quantity,
yeah,
which is the point.
Yeah. And what is your experience, Mrs. Raymond? At the age of 72, you underwent this surgery?
I feel very good. It's not too much pain. I stopped my pills for the diabetes because my blood, it's okay. And I wish one day I don't need my machine to breathe 9 times because when I sleep I stop breathing.
Okay, so it means you, you are using your CPAP less duration of time in a daytime, right? You are using once a day now. And what about your diabetic medicine? Are you taking the same medicine now after surgery which you were taking before surgery?
I don't think I'm going to have to take again.
Okay, so now the Mrs. Raymond had stopped all the medication for the diabetes which she was taking for the diabetes after mini gastric bypass. Today her blood sugar is also 91. So how you take it? 91 blood sugar is very good and without any medication. So it means you have cured your diabetes now. You are no more diabetic patients now. You are a normal
Yeah.
human being now, normal young lady.
Yeah.
You can say.
Yeah.
So anything else you want to tell our viewers? You want to give any message to them?
Everything.
Because so many people of diabetes, of obesity, they are very scared of surgery. They said, no, without surgery, if you can do anything, please do that. With the medication, you reduce my weight, you cure my diabetes. But with the surgery, oh, I cannot. So what is your message to them?
To make it, the operation.
Yeah, make the operation.
Because if you get big, you have problem in the way to, you can run, you can do nothing. You work, or you have to sit down, and you have hard time to make to go to the market to buy something.
Yeah. Your activity level. You mean to
Yeah.
say your activity level has increased now?
Yeah, and now sometimes you have to do something outside. You play with my grandchildren.
So that is very important because the obesity restricts you from your normal activities.
Yeah,
And after surgery, when you are going to lose your weight, you can play with your grandchildren.
Yes.
You can cook for them. You can go for the shopping.
oh yeah.
You can go for the social gathering.
It's about taking charge of your life.
Yeah, it's
What it
it's a definitely it would be a new life. It would definitely change your life.
And if somebody is big and he complain, be cry, gonna say, hey, do something for your life, go there and
Go
you're gonna
see
get
Dr.
paid.
Saggu.
Yeah, thank you so much.
Yes.
And I think you are going to stop your CPAP within a month or two, and you are going to stop your depression medication also. So my request you to please follow up your physician over there, check your blood sugar and everything over there, check your pressure readings for the CPAP, right? And you are gonna stop your all the medication, but don't forget to take the vitamins.
Oh, yes.
Don't
Oh,
forget
no.
to take the proteins. Don't forget to do exercise, daily exercise, because these are the few mantras for your life which will change your life. Do your exercise, do your walking, take your vitamins, right? Take your protein shakes and everything. You will be all right. Take a lot of liquids.
I can tell you a big thank you.
Yeah, you're welcome. Thank you so much. Thank you so much. I think the next time when you will come after a year for the follow-up, you would not be 72-year-old. Then you would be around 24-year-old.
I'm gonna send you picture.
You're going to become more younger then.
Yes.
Yeah.
Something to look forward to.
Yeah. Thank you so much
Thank you, Dr.
for
Saggu.
choosing me as your surgeon.